Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday the 11th of August 2021. The numbers COVID-wise are that we've got 25 positive inpatients today. That's within 14 days of their first diagnosis of COVID. And there's another 10 patients who are in because of COVID, but they're more than 14 days post the first diagnosis. Of those 25, 5 patients are in critical care. Again, a reminder of what a serious illness COVID is and can be. And then we've got 20 who are spread out across the hospital, actually. Some in maternity, some in paediatrics, some on our general wards, and 1 or 2 in surgery wards. And so it does make the point that some people are in hospital with COVID, who have COVID but have come in for other reasons, and some people are in hospital who are really poorly with COVID, and we're still seeing that. And I'm sorry to say we had 2 further deaths in the week of people within 28 days of their first diagnosis of COVID, and that takes our total figure up to 781. So because of there still being a pretty high prevalence in the community of COVID, and because it is still a big issue within the hospital, we're going to keep our visiting restrictions in place for now. So we're still allowing visiting for end of life and to maternity and to paediatrics. And the key details, as ever, are on our website. I want to reassure everybody that we really don't like restricting visiting. I've said this before. We review it formally every Monday morning and every Friday morning. And I don't think this Friday we will be in a position to ease it off just yet. But I assure you, we look at it regularly, and we will ease those restrictions just as soon as we can. But thank you for your forbearance with it. In terms of the community numbers, Blackpool 491 per 100,000, which is exactly the same as this time last week. So that's levelled off a little bit. But the figures for Fylde and Wyre have dropped a bit. Fylde is now 320 compared to 344 the week before, and Wyre has dropped to 280 compared to 334 the week before. I think 280 per 100,000 is the England average. So Wyre's come back to average, but obviously we want to see those figures coming down. There's national media showing that 3/4 of the adult population in England have been immunised with both doses. Fylde and Wyre are doing a little bit better than that at 79% for second doses. Blackpool is at 70%, so a little bit of work still to do in Blackpool, but in fact everywhere, because still the evidence is compelling that vaccination is the most effective way to reduce both personal illness and transmission. I've picked up a bit of sort of correspondence and discussion about individuals, often quite young adults, who are saying that they don't see themselves as being individually at risk of COVID and therefore are not going to have the vaccination. So I think it's important to remind everybody that the vaccination is both protective to the individual, but also, and incredibly importantly, it's about protecting the whole population. And the more people who have it, the less dangerous transmission occurs, and the safer everybody is. So having the vaccination is not just about one's own personal health, it's about the whole population, and I hope that people will balance those ideas when they're thinking about whether or not to have the immunisation. The stat is that the hospital has given over 39,000 doses of the COVID vaccine now, so heading towards 40,000. So that's an amazing, an amazing statistic, isn't it? Going right back to when we started the programme in December 2020. We are working through plans now to begin flu vaccinations, and still checking out the national guidance about whether there will be a COVID booster booster or not. Either way, if you have ever been in an at-risk group for flu, once we start doing flu vaccinations, both in general practice and in hospital in September, I strongly advise you to get that jab as soon as you can. There was experience from the Southern Hemisphere that flu became quite a big problem. And we certainly worry that that could be an issue as we go into winter here. So I'd strongly urge people to get the flu jab as and when it becomes available. And perhaps finally, as I've said before, our emergency department has been extraordinarily busy over the last few months, and we assume some of that is a sort of latency from conditions that have perhaps progressed during the COVID period. Nevertheless, the department has been seeing over 200 people per day and sometimes over 100 ambulances arriving. So I'm afraid there have been quite long delays at times, and we've really felt under pressure. So if you do feel that you have a problem that is urgent but not an emergency, then please will you look at the NHS UK website or dial 111 for advice before coming to the department. Of course, if you're experiencing a life-threatening emergency, then please dial 999 and the services will respond. So I think we're seeing a slight improvement in our COVID numbers. The population levels look to be coming down, but not perhaps as quickly as we'd hoped. I think we still have to remain cautious and alert. Remember to wear a mask in public places and keep a safe distance, and always wash our hands. Thank you very much.